So for a long time, skin whitening has been in very large demand in Asia for a variety of sociocultural reasons, where it makes up nearly 1/3 of the personal care product market. There's now a growing market for skin whitening in North America as well. The main use of skin whiteners in the West is to even out skin tones or correct hyperpigmentation, rather than to change the overall color of the skin. Skin whitening or lightening treatments are used to treat a variety of things, including age spots or sunspots, irregular skin tone and minor blemishes, and post-inflammatory hyperpigmentation. Melanin is the main contributor to skin color in humans. There are many factors that can influence how much melanin is produced and the distribution, including sunlight, genetics, hormones, skin damage, and other environmental exposures. Most lightening treatments aim to reduce or block melanin production, and there are several common active ingredients used for this purpose, which include hydroquinone, arbutin, and kojic acid. But there are also a variety of other natural and synthetic ingredients. Topical treatments are by far the most common way to treat pigmentation problems. Combined with vigilant sun protection, topical treatments are safe, inexpensive, and effective at improving hyperpigmentation. There are, however, a few other options for treating hyperpigmentation, and these are usually performed by a cosmetic dermatologist in an office setting. Laser treatments can be used to treat certain pigmentation problems, and chemical peels can alleviate superficial hyperpigmentation by removing pigment from the uppermost layers of the skin. First, there is a distinction between over-the-counter and prescription products. Both generally use similar active ingredients and mechanisms to lighten the skin, but over-the-counter products generally have a smaller concentration of active ingredients. There are a variety of effective over-the-counter products available, but some good things to look for include first, the manufacturer's reputation. Second, what are the active ingredients in that compound? Third, you want to understand whether that product has shown clinical tested efficacy. And lastly, what about the skin tolerance? So for example, does this product irritate the skin, cause itching or pain? It's important to know those things. Neostrata's SecureWhite cream is an example of a product that has been studied extensively for efficacy and safety. SecureWhite cream uses a trademark formulation, ActiWhite, and Radiant Skin to lighten skin tone while ensuring that it is friendly to people with sensitive skin. Its active ingredients inhibit the production of melanin, which is responsible for hyperpigmentation. Some of the benefits of the product include the fact that it's been studied for efficacy in clinical trials. It was shown not to irritate sensitive skin. It includes retinol, which has anti-aging properties. And some of the products in this line contain sunscreens in their formulation. Clinical tests show that SecureWhite works well for people with sensitive skin. In addition, trial data demonstrated effective lightening after just 56 days. The usual precaution with all topical medication applies. Patients should take care to avoid contact with the eyes and other mucous membranes. Patients should not ingest the product, and the product should be kept out of reach of children or pets. After use, you should be sure to wash your hands carefully to remove the product. Sun protection is a critical element of treatment. Sun exposure, as we know, is the most common trigger for darkening skin and hyperpigmentation. So preventing the pigmentation in the first place is, of course, best. However, it's also very important to continue sun protection during and after treatment. So many ingredients used in skin lighteners can make the skin more photosensitive, amplifying the effects of sun exposure during and immediately after treatment. Hyperpigmentation can recur shortly after sun exposure, reversing the gains made by topical therapy in a short amount of time when exposed to sunlight.